that I'm blessed. It's a few L's and millions, so turn that loss to a
Dr. King, thank you for being here, man. I really appreciate it.
Thank you for having me.
So we call this the Father Alchemist, and really where I came up with this name is when you think of the Father, not only does it have a reference to me being a father of two, but also, when I think of father, I think of somebody that's a protector, a provider. If you think of Father God, it's sort of all-knowing type of concept. And then alchemist is really taking a base metal, transmuting that into gold. So if you think about like a modern day human alchemy, it's helping people go from where they're at to the best version of themselves. And so the show's really meant for entrepreneurs. It's a show around entrepreneurship and mental health, really. I think that anytime you run a business and you're trying to accomplish something great or do better for yourself or for your family, there's always this sort of mental image picture of what you're trying to attain or create. And sometimes it's hard to sometimes you never reach it, right? And so I think a lot of people in the entrepreneurial space sometimes struggle with depression, anxiety, feelings of inadequacy, just always second guessing yourself. And it's hard. Business is difficult. So, and for those of you listening, listen, I wanted to have Dr. Kit. This is a really, to me, it's a really special episode because it's something that's really near and dear to my heart. It's something that has affected me personally, and we're going to talk about that today. But Dr. King runs a practice in Golden called Peak Ear, Nose, and Throat, and really specializes in something that I never knew existed until it was something that I was being challenged by. And so I'll kind of share my story, and then I'd love for you to introduce yourself and just kind of share with the audience a little bit about, who you are and how you came into this role. So for me, it was, it started really about, what do you think? 3 years ago, 4 years ago?
I think that's when we first met. Yeah. 3 or 4.
This is about 3-4 years ago. I was going to my primary care physician, and all I knew at the time was there was something going on with I didn't even know. I didn't is this my throat? Is it my voice box? I didn't really know what was happening, but I knew that when some people would say, oh man, it's because you talk a lot. I knew in the back of my mind, I'm like, I don't think this is it. And so of course there was, there was a lot of, I was scared because I'm going, man, what is this cancer? What is this? And it was something else going on. So anyway, my primary care physician finally said, I want you to go see this speech therapist. So I went and saw a speech therapist, and I'd seen her once. Then I went back a second time, and she says to me, Darik, I could see you every week for the rest of your life, and I'm never going to improve this situation that you have. She says, but I think I know what might be happening, and I want you to go see Dr. King. And so now fast forward, 3 years beyond that, I have a voice again, I can talk again. And when I first saw you and you said, hey, I can fix this, or I can help you with this. I remember leaving, man. I called my wife. I started crying because it was finally, there was an answer. There was a solution to it. Yeah, exactly. Yeah. So, for those that don't know you, why don't you introduce yourself, your practice, kind of, who you are and how you came into this role, and a little bit about this specialty.
Sure. So I'm Michael King. I'm a founder and co-owner of a private practice here in Colorado. It's called Peak Ear, Nose, and Throat. Started off with the specialty being a voice center to treat various voice and airway disorders, but has grown over the last 12 years to encompass sort of a broad general ENT practice. I've now got a couple partners and other providers in our group, and 4 different offices now across the Front Range.
4?
Yeah.
Oh, so wow, good for you.
Golden's where we met and where is one of our hubs, but we have another office in Broomfield and in Denver and Brighton.
Which one opened first?
So Broomfield and Golden were sort of simultaneous. They were
Okay.
the beginnings.
Okay.
And then Brighton came along a few years later, and then Denver's our most recent office. It opened about 3 years ago now.
And how many partners?
So I have one co-owner partner,
Okay.
and then we've got 2 additional
Like silent.
MDs or physicians. So
okay.
4 doctors and
Okay.
4 physician assistants or mid-levels.
Okay.
And then we have 4 audiologists because we also specialize in hearing disorders. And then a lot of medical assistants and other support staff. So it's grown from initially it was like my wife, myself, and one other person. It was literally 3 of us to now having over 30 employees. So it's been a pretty crazy venture over the last
for you.
12 years.
Yeah, when did you start the practice?
2011.
2011. So you've done a lot in a pretty short period of time with this.
Sometimes it seems like an eternity, but yeah, I guess in perspective, it's certainly been an interesting course of events. I don't think I planned it this way. We can maybe get into that if you want, but it's certainly not anything that I set out to achieve this. It's
what did you go to school for?
well, that's not what I meant. Sorry, I meant the
Oh.
business part of it.
Okay, I see.
I did go to school for this. This isn't what I intended to do. I met some, in medical school, you sort of rotate around different specialties and learn about different things that are out there. Most of your rotations are like 3 or 4 weeks, and get to sort of experience what different specialists and specialties do. Some you hate, some you kind of like, and some you're like, oh, maybe I could see myself doing that someday. And then after medical school, you choose it's called a residency, and that's where you specialize in whatever you're going to do. So if it's primary care or cardiology, surgery specialties, whatever it may be, and the residency is that's your thing. So ENT was my residency of choice, and I was fortunate enough there to have a mentor, and one of my professors kind of took me under his wing. He was also a voice specialist, and I loved the things that he could do to help people with their voices and their breathing disorders and problems of that nature. And the more I spent time with him, the more I knew that was for me. And so ENT is the sort of broad category of specialty. And then within ENT, there are subspecialists. So voice and airway is one subspecialty among a few others that I chose to do. So I did a little extra training in that, and then came back to Colorado after finishing way too many years of school, and then
I bet.
started with another practice in Colorado. When I first moved back home, I was doing my training in San Antonio, Texas. That's where I did most of that. But Colorado's where I was born. This is home. So I knew I always wanted to come back here. So I got fortunate enough to have an opportunity to join a group that was existing and starting up a voice practice. The intent was to kind of make that a long-lasting gig, but it turned out not to be in the cards. I won't get into that story. It's too long and painful to go into. But long
Did
story
they
short,
own the practice previously, and then you took over
I was
in
just an
some way?
employee
Okay, got it.
hired by that group.
Okay.
And for various reasons, it didn't work out. And I was sort of left with this, oh crap moment. Like, what am I going to do now? Because my plan coming out of schooling was always to just join a group and get this voice thing going. But I never imagined that I would start my own thing from zero, from scratch. And
So you were almost put in a position where you had to choose, like, am I going to be an entrepreneur and do this? Like, understanding probably some, but not all of the risks. And then, or, what do I do? Do I go and find another group, or what's that look like? So,
yeah, exactly. I was kind of left with this. Do I find another job? Do I potentially leave my home state? Because, I mean, it's not always easy to just join a group, especially as a specialist. There are only so many positions available for various things, depending on what you do. So it was an awkward situation for sure. But I guess just in the couple years that I'd been out, I had a little bit of a following. I was just sort of just getting my name out there, and that this could be a niche. And I think there was a need for it in Colorado. There aren't very many voice specialists here. There were a handful at the University of Colorado. And that was really it. So, I mean, for a growing state and a large population along the Front Range anyway, there just weren't a lot of people that did what I knew I could do. It was just a question of whether I could build it. Medical school does a terrible job of training docs to be business people. We're very well trained to do what we are trained to do, our specialty and our medical aspect of things. But I think this is a severely lacking problem within our broadly speaking, our education for medical school and medical providers.
I think with most industries, right? Because most industries, if you're going to start a business, you really have to know how to sell. You have to be good at marketing, accounting, finance. They're hiring, leading people.
Yeah.
They're all the things that you don't learn, but you do know this. But you do have that specialty, right?
Yeah. So that was a bit of a challenge for me to come out of that situation and say, well, can I do this? How would I even begin to do it?
Was your wife supportive at that time? Like, what was she thinking?
Hugely. Yeah. I wouldn't be here if it weren't for my wife and my family. I mean, I couldn't have done this by myself by any means. So I was very fortunate to have a supportive spouse, and my parents in particular were, I guess in two respects, encouraging and sort of that you can do this, sort of that uplifting, I guess, moral support. And then the literal financial support I was very lucky to have parents who could afford to sort of get me at least a little bit started. I did get a business loan, a SBA loan to get going, and
that's awesome.
Paid my parents back in full and got it going. But yeah, it was a tough sell to myself, and like you said in your intro, I think I definitely fit the bill for that kind of oh crap moment of can I do it? Am I good enough to do what I want to do? I mean, even if you have if you have a vision, thinking it and making it happen are sometimes two different things. So
once you got past that though, like once you said, okay, I'm doing it. I got the SBA loan. I'm doing it. What were some of the initial, like within your first 12 months, what were some of those initial challenges? And would you say that they had to do with actual, practical, like hiring and just running of the business, or was a lot of it still like mindset challenges?
Probably a little bit of both. The practical issues were, finding a roof, finding a literal space to do it, coming up with the capital to buy all of the equipment needed. I mean, my specialty in particular is pretty pricey to get going. It's I need a lot of tools and gadgets and scope equipment and various things to be able to do what I do to see people's throats and voices. So different story. If I were going to go into psychiatry, I just need a couch and a nice comfy chair, comfy room. But this was different. So coming up with the literal equipment needs was a challenge. The space was a challenge, and then as we did get going, employees became a challenge. So finding people that weren't scared by my starting this. I mean, you can imagine as an employee too, I'm a little bit of a risk, right? It's like, I don't want to go with that guy.
Well, it's a startup, and
you know what he's doing.
Yeah, right.
So I was also very fortunate to have a medical assistant who had been with me at the initial job I was in. She left kind of with me, and we both jumped ship. And I convinced her somehow to come and believe in me, and she always had that faith in me too. So
that's awesome.
I should add her into the mix of people that helped me go to make this happen, because I couldn't have been.
And man, you need those people, right? Like you need people to be cheerleaders for you, because there's so many other people that are trying to tear you down and, plant the seed of doubt, and really it's their own insecurity with what they've not been able to accomplish. And sometimes that comes out in other people, especially now with social media, right? There's just people looking to pick a fight almost. And it's just, it's sad, but it's, they're also the person that's 500 pounds sitting on their couch eating, fucking Doritos and shit. But talk about, talk about my issue specifically, what it's called, walk everybody through the procedure. Cause I've shared this with some people, and like sometimes I'll take photos where I'm sucking on the nebulizer, you know, but I never want to look at the camera photos after we're done of the throat, you know, but, so walk people through kind of, you know, what it is, what it's called, the diagnosis that you gave me, and then sort of what that whole thing entails. Walk them through that.
Sure, you're comfortable sharing your story.
Yeah,
I'm not used to people wanting to talk about their medical issues.
Yeah, I mean, I just think that
respect your privacy, but if you're cool with that.
No, I'm cool with you sharing about it. And I think that there are probably a lot of people out there that really struggle with some version of this, or that struggle with this. And like myself, they didn't know, like, and they still haven't been able to figure it out, right? Because they never saw a speech therapist, or they never, you know, happened to run into an ENT person that specializes in this. So it's like, I imagine there's people out there. So if I can, even if one person hears this and they're like, shit, maybe I need to go call Dr. King or figure this out, it's worth me sharing.
No, I think that's a very good point. I know that's the case because I see people all the time who unfortunately kind of went years and years with whatever their problem is, and sort of didn't even know that it was a thing, or that there was somebody out there that could maybe help with it. So yeah, so what you have is called spasmodic dysphonia. It's a type of dystonia, which is a neurologic condition that affects muscle and nerve groups that in your case specifically affects vocal quality. It's a spasticity of the muscles around the laryngeal muscles, or the vocal cord muscles, that causes them to twitch in a way. So I think a good analogy is to think of people like if you get stressed or you're overly tired and your eyelid starts twitching, a little twitchy thing. There's a neurologic condition with it's called spasmodic dysphonia, where the vocal cords are essentially doing that same thing. It's an involuntary, uncontrollable muscle spasm. So you can't like will it away or consciously get it to try to relax. It's actually a brain disorder. It comes from the brainstem. It manifests as a voice disorder, but technically it's a neurologic condition that begins in the brain. But interestingly, it doesn't affect any other part of the body at all. So it's, even though the coin, like neurologic condition, is always kind of a scary thing to hear, because everybody imagines the worst that could be someday. But fortunately, even 30 years of living with that spasmodic dysphonia never affects any other body part. So, however, it's a big one, right? I mean, voice is largely who we are. And I think that's what gravitated me towards the specialty, is I could see the mentor that I was mentioning earlier. His name's Dr. Simpson in San Antonio. I could just see all the differences that he could make with helping people like yourself or with other voice disorders. Not to sound too cliche, but it can be life-changing. I mean, it can be life-changing to have the disorder, and it can be life-changing to then be able to help someone fix that. And I think voice is such a huge part of who we are. It's how we express ourselves. It's how we communicate, of course. It's how we perform our jobs. It's how we communicate with our family and friends. And when you lose that, it sort of diminishes your core being in some respects. So it's a problem. And when I meet people like you that talk for a living, you're nervous about talking to anybody. It's sort of, you don't feel confident. It's a,
it's funny. So as I was driving home from the gym this morning, I was kind of thinking about you coming on today. And I thought to myself, oftentimes we hear about like, oh, can you imagine if you couldn't hear, right? Or imagine if you were blind, if you couldn't see. I don't know that I remember hearing growing up as a kid, like, imagine if you didn't have your voice, right?
Yeah.
I just, that was never something that I ever thought about, it's just, I kind of took it for granted, as anyone would do, but yeah, because you have it. But, so I thought that was really interesting. Like, man, more people need to be aware of how powerful their voice is, and, be grateful that you have it, because I could only imagine trying to communicate the rest of my life by typing or something, or like, how do I communicate without a voice? So, but there's also, you're right. There is and the reason I understand that it's neurological, even if you wouldn't have said that, there was some part of me that sort of knew that it wasn't just isolated to the muscles around my voice box, because when the when the procedure, since we haven't talked about what it is yet, when the procedure wears off, right, and I don't have the ability to use my voice, or not as well as I normally can, when we go through the procedure, I find that I'm trying to say words that aren't necessarily the normal language that I would use to communicate, because it's an attempt for me to like shortcut my own brain's delivery of the word, because I can't actually say the word normally with the affliction. So I'm trying to find a way to like shortcut it.
Yeah, you're circumventing the words that aren't going to come out right.
Yeah, exactly. I'm the words I know aren't going to come out right. But through that process, it sort of like trips you up on, I don't know. And then for me, it really became like, almost like I'd have a little pity party with myself, and I'd lose confidence, right? Because I would then start to think about how other people are perceiving what I'm saying and how I'm delivering it. And it was this whole thing, man. And so, you don't realize that the voice is not just how you communicate, but it's really affecting who you are, like you said, and your ability to, your ability to effectively communicate gives you confidence. It's what allows you to be confident. Mm-hmm. So, and there are two types. So I have adductor spasmodic dysphonia, and isn't there another one called abductor?
That's right.
And what's the difference?
They affect different muscle groups. So the adductor kind that you have, which is by far the most common kind, probably 95% of people with spasmodic dysphonia have that, affects the vocal cords to spasm tighter. Okay. So typically your voice would sound strained, tight, kind of choppy at times. Broken is another word, where it just feels like it breaks as you're speaking. And it more dramatically affects vowel sounds. So the E, A, I sounds, those tend to not come out right when you're speaking. The abductor type, AB ductor, affects the vocal cords to open abnormally. So people tend to sound breathier, weaker voice. So they're almost like somebody has a laryngitis sounding voice, where it's whispery, weaker, volume projection is lacking. So it's a strained versus breathy is the main difference. Okay. So,
which I've experienced both, right?
Well, you have experienced the
breathy
side
version,
effect
but
part
the side effect
of the treatment. Most people don't have a mixed version of that. That's rare. But I guess we could get into the treatment if you want. So that maybe makes more sense.
Yeah, talk about the treatment and sort of that, like leading up to it too, because I know, for me that whole process is really just a little unsettling, and it's like, I remember thinking to myself, until you told me that there is adrenaline in this, shot. I'm like, dude, I need to be calm, but I'm like, my heart's fucking pumping out of my chest, you know? So walk us through that.
So as your speech pathologist alluded to, voice therapy is not usually very helpful, because voice therapy is geared towards voice disorders that are more behavioral, like you're doing something unbeknownst to you subconsciously that affects the vocal quality, whereas a neurologic condition is involuntary. As she said to you, you could do voice therapy forever and it would never improve, because they're asking you to change something you have no control over. So voice therapy is not typically very effective for this type of voice disorder, as it may be for others. Because it's a neurologic condition, we're trying to reduce the spasticity of those muscles. You can inject Botox medication into those muscles that intentionally weakens them because if you want to think of the muscles that are spasming as overactive, I keep moving my fingers because I'm mimicking what vocal cords look like. They sort of look like a V. And as we talk, they come together. And as you breathe, they open. So if they're overactive, they're coming together too tightly.
Okay.
So by injecting a small amount of Botox into those muscles that bring the cords in, you can effectively weaken them enough to not sound strained and tight anymore, but not so much that you have no voice, because as you've experienced, it's a fine line between too little and too much. So it's a Goldilocks dose that we're always looking for in every patient to try to minimize the side effects of Botox, by and large meaning too much Botox, which would give that breathy quality that I think you were talking about earlier, where you sound weak, airy, hard to project, low volume. And that's the unfortunate side effect of Botox when it's too much. When it's just right and you kind of find that sweet spot over time, generally it's fairly predictable and can expect similar results with each injection. As you know, the downside to Botox, even though it works great for this disorder, is it doesn't last more than about 3 months on average. So unfortunately, everybody with this problem is going to sort of be a lifelong Botox injection, or is going to need Botox injections as long as they're wanting to get it treated. So usually everybody that has spasmodic dysphonia, or SD for short, get to know them pretty well, like you, because I see them every somewhere between 2 and 3 months on average. And I've got patients that I met when I first moved to Colorado that are still seeing me today, 12, 13 years later. So it's develop a relationship, and it is what it is. Nobody loves getting these Botox shots through the neck, but it works. And I don't know if you want to go into detail about what those procedures look like. Maybe you can speak to that.
We should talk about it. But I was going to ask, when did Botox become like the gold standard for this procedure? When was that found out?
Yeah, that's a great question. I should know that off the top of my head, but I don't know the exact answer to that.
I mean, did Allergan, was that, is this, obviously it happened before you entered the field?
Oh yeah.
It was available when you entered.
Yeah, this was long before I went through training. So as I was going through training, this was already the sort of gold standard way to manage spasmodic dysphonia.
Okay.
I'll have to get back to you about that. I don't know the answer.
Yeah, that's fine. We'll put a link, or we'll put something in the description, guys. So basically, I go through this process, like Dr. King said, every few months I go in and see him, and there is a series of numbing agents that that are either given to me or that I have to take to get every part of my, and maybe you can speak to this, but basically every part of my neck, my throat, everything going on the inside, it's all gets numbed out, right? So the first thing I do is I have to inhale a, what is it called again?
It's just a lidocaine mist. We put
lidocaine
in a liquid lidocaine, and it's called a nebulizer. You just sort of inhale that over 10 or so minutes. That helps to get you started with the numbing on the inside of the throat. We do a similar lidocaine injection around your Adam's apple, around the skin of your neck. So that's the access point that we get into your throat. And then the way that we see where that injection is going is by visualizing that with a camera or a scope in the nose. That's a little flexible scope that goes down the nostril and into the back of your throat. So we numb your nose so that you can tolerate that scope. So it's certainly an awkward place to get to, and the vocal cords would fit on a nickel. So we're trying to hit a very precise spot, and if you miss, it either won't help you or it'll weaken something you don't need to be weakened.
Right.
So the accuracy has to be pretty spot on. So we can't just kind of do that blindly, or poke your neck and hope for the best. That's not going to work. So to make sure that we're going in the right spot, we have to visualize it by having a camera in your nose at the same time that we're going through the outside. I keep saying we because it's kind of a team job. It's you have to do your part to stay chill and relax, like you said. And I have a partner who helps me with these procedures, an assistant who does the scoping to visualize the inside of the throat. We have a little screen or a monitor where I can see that. And then I'm doing the injection through your skin after you're all numbed up and ready to go, so that the needle's going into that precise area.
Yeah. So I just, the nebulizer's not that big of a deal, right? And honestly, that next shot really isn't. I mean, it definitely stings. I notice it, but it's like there's a needle, right, going into the skin above the Adam's apple.
Right above it, yeah.
Okay. Yep. So then and how long does that take effect?
It's usually pretty fast, within
pretty quick. It's
5
happening.
minutes less.
Okay.
Yeah.
Okay. And then from there, you're squeezing that stuff into my nose. What is that?
That's a topical,
just a topical,
similar to lidocaine.
Okay.
It's called tetracaine. It's just another one of those numbing agents that topically numbs your nose. So some people do the scopes without any numbing, but it's
I see.
weird.
So that's for the scope.
Yeah,
right.
That's just for the camera to be able to get in there.
Right. Okay. And then so now I'm numbed up, but there have been like this last time where it's like it didn't take or something. It was weird. And I don't know if that sounds like that's not normal. So I don't know what was going on with me that day, but it was basically like my gag reflex it wasn't numb. So I was feeling everything. It wasn't that it was painful necessarily, but it's like I felt it. And then I would cough or I would swallow. And then I couldn't believe when you showed me those needles, like every time I would do that, it would like kink them and bend them. I'm like, dude, I felt so bad. I'm like,
not your fault.
I know.
Yeah, I don't know why, because you've always, I think by and large, done pretty well with these procedures, and it's certainly an awkward process. Nobody loves it, but if we can get you adequately numbed, you shouldn't really feel much. So I don't know what happened this last time where the numbing
2 rounds of the nebulizer, So what has there been anything in that process and in general that tends to be challenging for people? And then also, talk to me about what you do when you're having me do the E and it's like feels like something's dripping in the back of my throat. What is that?
Oh, that's just one more little added numbing that sometimes people need to help. The nebulizer does a pretty good job of numbing your throat, but it's not maybe 100% as you experienced in that last time. So we're having you essentially gargle lidocaine. So we're dripping the lidocaine over your vocal cords as you say E. It bubbles on your cords and really numbs it. So it's sort of the last of the series of numbing steps to really get you to hopefully not feel any more of that needle. It's sort of a necessary evil because nobody would be able to tolerate a needle sticking into the inside of their throat. We're designed to cough and gag for a reason. Anytime something's abnormal in our throat, that's sort of a protective reflex. So you would be able to voluntarily let somebody stick a needle there. So you kind of have to numb it to some extent to be able to tolerate me doing that.
And how many, and I'm not looking for an exact number, but like how many people are affected by this? And like, do you have 5 people come into your practice for this, or is it a larger number? Or?
No, you'd be surprised.
Really?
You're not alone. If that makes you feel better. I think a lot of people feel better just knowing that they're not
the only person.
Such an anomaly. Again, I probably have to get back with you about the incidence of it in a large population, but at least in my practice, I think I have, at last count, maybe 100 patients or so that are rotating through at any given time over the years. Now some move away and they probably find somebody else, but I think people that stay around in the Denver metro area, I see. And there are just, as I was mentioning earlier, there are not a lot of voice specialists in general. There are a lot of ENTs, but not a lot of voice specialists who are comfortable doing these procedures in general. So that too becomes a little tricky for patients to find docs that do this kind of stuff. There are literally 4, maybe 5 people in all of Colorado that do this regularly. So that means for people like in more rural areas, Wyoming, Nebraska, New Mexico, even the western slope of Colorado, they end up driving a long ways to be able to find providers who are comfortable managing this. So in my practice, I see a lot of people who come from neighboring states and
Jeez.
even the western side, Grand Junction and all.
So I'm lucky, man. Like
Well,
you're in my
lucky that you're
backyard.
close.
Yeah.
That's
Yeah.
fortunate. But yeah, we have people driving 4 or 5 hours to come.
No kidding.
I have one patient who literally flies in the morning of the injection and flies back home that
Is that
same
right?
day. So that's access is sometimes tricky. But yeah, it's a larger group of people than I think you would think. And as you started this whole podcast talking about, I think there are people out there who are living with various conditions that affect their voice, and either don't know that it's a thing. They just sort of think, well, that's just how my voice is, I guess, or that there's something that could potentially be done to help it.
So for somebody listening to this right now, that's like, man, maybe I've got this going on. Is there any way that somebody would know without, because I'm thinking like, unless this speech therapist happened to know about it, like what if I saw her and she didn't even know this existed either?
Yeah.
She would have just either kept seeing me, or she would have said, I can't help you, but maybe wouldn't have made an introduction to you. Is there any way somebody can, like, are there any practical steps or like testing they can do to know whether they might have this without seeing a specialist first?
It's a little difficult to self-diagnose just because there are some voice disorders that may sound similar to spasmodic dysphonia, just the quality of the voice. So I guess you just have to have enough experience to know what it sounds like, because it is very much you can make the diagnosis just by listening to somebody.
You can.
I mean, I prefer to do a scope when I meet somebody for the first time with spasmodic dysphonia, just to make sure there's nothing else going on.
What are you looking for?
Well, any other disorder in the throat. So any growth, for example, or a lesion on the vocal cords.
I see.
Ruling out things like a tremor, for example, that can sound similar to spasmodic dysphonia. But by and large, you can hear somebody just talking, and or I know that that's
I would know
spasmodic
now.
dysphonia.
Like I would know.
Yeah,
now.
and I think anybody with spasmodic dysphonia has now become so familiar with it that if they heard somebody else in the grocery store, they'd be like, I know what you have.
Yeah, totally.
But some voice disorders, you can't tell until you kind of look and rule out various other things. But SD is a very characteristic sounding voice. You can, if you've heard it enough times, you can pick it out of a crowd.
So maybe somebody that's wondering, they can maybe even go to YouTube and look up spasmodic dysphonia and just hear it and see if that's similar to what you have
There's
going on.
a support group for spasmodic dysphonia. There's
right?
spasmodicdysphonia.org that has voice samples on it. My website has some voice samples on it. So yeah, if you just Googled spasmodic dysphonia and listen to videos or something, you might be able to hear what a kind of quote unquote typical spasmodic dysphonia person would sound like and say, oh, that maybe sounds like me. But I think in general, seeing either a speech therapist who's familiar with voice disorders or an ENT who's familiar with voice disorders would be generally the first step to
Good place to start.
checking that out. Yeah.
So before we go any further, can you let people know where they can find you?
Oh, sure. So as I mentioned, we have 4 different offices. I don't personally go to all 4 offices. My hubs are here in Golden. We're near the government Taj Mahal buildings over there off of Johnson Road, and in Golden, and our other office where I go is in Broomfield, kind of near the Flatirons Mall, in that kind of Superior Broomfield border.
And it's Peak ENT.
Correct.
Yeah, Peak ENT. So highly recommend you, man. You've been awesome. And
Thank you.
I really appreciate everything you've done for me. I mean, really, it has changed my life. I mean, it's saved it for sure. And it's like I don't forget what that used to be like, and it's something that I just have gratitude for all the time. And that's why even though it's like, I kind of joke about it, but I'll tell people it's kind of like getting a bikini wax, like it really hurts for about 10 minutes and then you're good. But but that's what it's like. It's like this super uncomfortable thing for a short period of time. But
Because you've had a lot of bikini waxes.
I get them every quarter.
Kind of speak with
Yeah,
that flick.
right after right after I see you, I go.
Your audience is going to wonder about
Yeah,
it.
I know. So anyway, so yeah, if you think maybe this is something that you're dealing with, or somebody, please have them go check out Dr. King. And so what about for you with the business? Like what is next with the business? Like, do you want to continue to open offices, or are you happy with where the business is at? Like,
Yeah, good question. Well, I think when I started this and realized that this could be a good thing, that it was something that I think we could replicate at another office, and then someday maybe another office, and economies of scale is sort of growing that. It's tricky though, because growing pains with any business can be hard from an employee standpoint, maintaining consistency and the level of care. And there's only one of you, so you have to, one of me, so that you have to consider, can I bring on good people that can provide good quality care to patients, so that our brand, so to speak, is consistent across the board. I always wanted a business, in a medical business, where I could, or that other referring providers could send to Peak and say, you know what, it doesn't matter who you see there, they're all great. Instead of this, like, well, you really should see Dr. So-and-so, because don't see, his partner. I never wanted that. So I think that's been a challenge in terms of just recruiting and getting the right people. Everybody's going to practice medicine differently. That's the art of medicine, but finding generally just good people, good morals, isn't always easy. You'd be surprised. I think we all like to think that all docs are upstanding citizens, and by and large, of course, I think they are. But I think there are some that unfortunately probably have no business being in medicine. And
I think that's every industry, right?
Maybe, yeah. So I was very fortunate to find my partner. I mentioned Dr. Mills has been a fantastic partner. We've recently, in the last couple of years, hired on another one, Dr. Libby Bosco. She's at our Denver office. And Dr. Dickey is another provider in our group. These are the physicians. We've got 4 physician assistants who are also fantastic. And so I feel very fortunate.
Do they all administer that? Do they all help people with spasmodic dysphonia?
No. So good question. I'm the only one in our group that is specialized with voice. So if somebody's coming, I guess, to see us about a voice problem, they'll by and large end up in my door. Everybody's familiar with spasmodic dysphonia, familiar with voice disorders enough to, say, make a diagnosis. But then ultimately, once the diagnosis is made, they end up sort of funneling that to me.
Yeah, so it's almost like, how do you uphold, that the quality of your service is going to be there once you show up, but it's how do you build systems and sort of process around you showing up, scheduling, right? I would imagine you have to kind of schedule for a couple days out of the week, depending on how much of that specific thing is. Like, are there other parts of the practice that aren't spasmodic dysphonia that can be handled by anyone?
Oh, yeah. All ENT problems.
Most of it. Okay.
Hearing issues, nasal, sinus issues, throat problems.
So it's really just SD that requires you to be there. And so would you eventually have somebody else that can do it, so you can be in 2 places at once, kind of thing?
Yeah, I've thought of that. I think if we got bigger, that might at some point be necessary. It is in a subspecialty, like a very specified training, and you want to make sure you're not diluting your business, right? So you don't want to have too many people doing the exact same thing. You kind of want to diversify the practice so that I can help voice problems and my partner can help the tumor in their neck, and another person can help with their sleep problems and why they're not getting good sleep and can't breathe through their nose. So I think we want to diversify the practice enough to have multiple specialists in their thing, but as a group, we sort of take care of everything. So finding those right people that not only have the skill set to do what they do, but also the sort of moral compass and the idea that we're here to provide good care, provide good customer service, standardizing certain things, because everybody's going to have their own nuanced way of treating various problems. But can we standardize enough things to where when a new person comes to Peak ENT, can they all generally walk out with the same sense that they were heard, they were treated well, they have a plan going forward to manage whatever issue they came in with? Was there good communication? Is there, do people have the confidence leaving our group that, all right, that they can help me with why I came in? So I think that's been the challenge in growing the business, and the bigger you get, the harder that gets. I think for right now, I'm probably comfortable with 4 offices. It's a lot as it is. My wife may divorce me too if I try to get a 5th office. That may go badly for me. So it reaches a stress threshold where it's kind of like, yeah, that's good.
Is there a way to do research? I mean, people can always move, but like, is there a way to, I'm sure there's data where it's like, you can identify where there's a larger,
a need.
Yeah, where there's a need for it. Right.
Yeah, and that's by and large how those offices came to be. Back in 2011 when I started, there really wasn't anybody in the Broomfield area. Really wasn't anybody on this side of the Golden area, and I chose that location because it was close to I-70. It was close to access from mountain towns. There's nobody really. The next ENT up the hill is kind of in that Breckenridge Vale area, so it's a large population, people from Evergreen and Conifer and Bailey and Idaho Springs, where they don't really have anybody to go to. They would need to come down into the Denver metro area. Most people living in the mountains hate the idea of coming to Denver, right? That's why they live up there, for good reason, that they don't like dealing with cities and traffic. So I think strategically just placing our office right off of I-70 before they even have to mess with Denver proper helped us to get that going. Broomfield's pretty close to the Boulder area, and there's a lot of people between Golden and Boulder who need help. So yeah, there was definitely some sort of market research in terms of where would make sense to build this. Nobody in Brighton again at the time, and Denver, you could argue, there are obviously many specialists and ENTs there, but I think as the city is rapidly growing and becoming such a popular place to live, that too has proven to be a good choice on our part. It's growing.
How many people are you able to kind of see at the same time, right? Like if I come in for a procedure, are you able to just, by the way you set it up or stagger the appointments, can you see 3 people and rotate 3 at the same time, more, or 2 is the max?
I suppose some ENTs or some medical providers in general may do that. I've never felt comfortable with that. I think there are too many variables to reliably make that work. Like your example the other day, that when we tried that, it wasn't going as smoothly as it normally does. It took more time. So if I'd had 2 or 3 other people simultaneously tried to schedule around you, that would have been a disaster. So I don't do that. Maybe some people do, but no, I just have one appointment, one time, and my focus is on that.
That's good.
One person until we're done. So,
Dr. King, thank you so much for coming on the show, man. I really appreciate it. And again, guys, Peak ENT, multiple offices, Peak ENT, Dr. King, and yeah, dude, thanks. Really appreciate it. This was
thanks
great.
for sharing your story too. That's kind of a brave thing to do. I don't think a lot of people want to talk about their health problems in general, and something that affects their core, their voice. So thank you for being willing to share that. That means a lot.
You got it. Well, we'll make sure you have some collateral. So if you wanted to use that clip to send out to people, you certainly could. Cool, man. Awesome. Thanks for coming on.
Yeah.
Every time that I see a limit, what? I push right past it. Don't care if you got here first, the one to win is the last one standing. Say my life is like luck, nah, I had to plan it. The way I work is out of this earth. I can feel the momentum. Need it all, no fractions. Dream it, then I gotta